My name's Dr. Ben Buchanan and I'm a clinical psychologist and co-founder of ReadyMind. And I work at the intersection of mental health, body confidence and cosmetic procedures. And we all know there's nothing more gratifying than having a patient who is really pleased with the outcome of a cosmetic procedure. They love the way they look, they feel good, the professional feels good. And the majority of the time, this is what happens when someone gets a procedure. But not all the time. And what ReadyMind is about identifying those clients that might not get that positive outcome. But unfortunately, the cases that keep us up at night, the ones that we worry about, are the ones that we know that no matter what we do, they're unlikely to be happy with the result. And that's good for no one. And so ReadyMind is really about identifying those clients who really want a procedure, but unfortunately, they might not be satisfied with the result. ReadyMind was born out of something I did back at Monash University years ago. We got 20 people with body dysmorphic disorder and we put them in an MRI machine to do a brain scan. Because what I wanted to know is why some people were perpetually dissatisfied with the way they looked, even though they looked great. And so what we found was that people with body dysmorphic disorder had physical differences in their brain when we compared them to people that felt fine about the way they looked. And so body dysmorphic disorder is the most obvious example of someone who has a predisposition for dissatisfaction. But it's only the tip of the iceberg. And there are many people that are getting cosmetic procedures that might also have this underlying predisposition towards dissatisfaction, no matter how good they look. And so since this fundamental MRI research, there's been a lot of literature trying to predict which clients are going to experience satisfaction after a procedure and which might be perpetually dissatisfied. And so what we sought to do with ReadyMind is give cosmetic professionals, surgeons, nurses, doctors, a tool that they can use to predict which of their patients are going to get the good results. And we obviously can't give a brain scan to everyone before they get a cosmetic procedure. So ReadyMind developed a quick psychometric assessment that a prospective patient can do before undergoing a procedure. And the results of that assessment gives the professional some insights into the psychological predictors of satisfaction so that they can know beforehand who's likely to get a good result and who might need a bit of extra support. So my hope is that when practitioners start to use ReadyMind, that they'll be able to identify which of the patients are going to get the best results and also be able to predict with confidence the patients that might not be satisfied. ReadyMind helps protect the practitioner. It's part of a holistic package for a patient where they're looked after medically and psychologically. And it helps us understand a risk that we might not have been able to identify before a tool like this existed. And it's been really great working with so many cosmetic professionals who have known for years that there's something about patient mindset which is so important during initial assessments with patients. And so ReadyMind has really just clicked because it makes sense to predict patient outcomes in this way.